Testing, testing, one, two, three.
Thank you. Have we any apologies for non-attendance tonight? No, I don't have any myself. Oh, sorry, no apologies. Any declarations of interest? We can take them as we go through the business tonight. Yeah, members, thank you. Our first item tonight in our health and recreation report is a presentation by the Macmillan Move More programme. And this presentation will be delivered by Nuala McVeigh. Nuala, you can just unmute on Zoom there and work away. Thanks, Nuala.
Hello everybody, hope you can hear me okay.
Yes, Nuala, yeah, go ahead.
So, hello everyone, my name is Nuala and I am the Macmillan Move More Coordinator for ABC Council. I will be presenting to you tonight about the Move More programme that I've been coordinating and delivering for 8 years for Council. So in Northern Ireland, every day more than 26 people are told they have a cancer diagnosis. Over 12,500 people receive a cancer diagnosis in 2020, and that number is expected to double by 2040. In relation to the ABC Council area, from 2016 to 2020, there were 5,150 cases of all cancers, which is about 1,030 cases per year. You can see roughly equally spread between the genders. So where does physical activity come into this? When people are living with cancer, becoming more active can be a positive change to make. Cancer and its treatments can make things very uncertain. Doing something for themselves, like becoming more active, can help people feel more in control. So what the research tells us, it reduces the consequences of treatment. Physical activity reduces comorbidities as well as disease progression. It decreases mortality and decreases the risk of reoccurrence. However, 77% of people living with cancer are not active enough to the Chief Medical Officer's guidelines. Even with all the physical, psychological, and social benefits associated with being active, there are still barriers in accessing activity. The aim of the Move More programme is that everyone living with cancer in Northern Ireland is aware of the benefits of physical activity and is enabled to choose to become and to stay active at a level that's right for them. So since 2016, when the programme first began operating across the borough, there have been many developments. The programme has gone from strength to strength. Funded by Macmillan Council and supported by the Trust, the award-winning programme goes above and beyond providing physical activity opportunities. It is a lifeline to many and has provided lots of opportunities to help people living with cancer in their recovery. So, personalised care is the forefront within my role as a Move More coordinator, and ensuring that the person's physical, practical, emotional, and social needs are met. Firstly, the programme is client-centred. I facilitate conversations and let participants identify their own needs. We focus on activities that will reduce the consequences of treatment, such as fatigue. We provide opportunities to make unique cancer connections and friendships. And finally, ensure that the person's entire well-being is addressed and signposted to other services if required. The Move More programme is a unique position to allow for deeper, meaningful conversations over a period of weeks and months, rather than just a limited 10-minute hospital appointment with nurses. Participants will see the benefits of engaging, the unique partnerships built between agencies, and the ease of referrals to other services, such as the Look Good, Feel Better workshops that are held at Loughnane Discovery Centre. So how does Move More help? The regional programme is for anyone at any stage. Participants will meet with me and we discuss the diverse menu of physical activity opportunities tailored to meet their needs. These can be cancer, non-cancer specific group or on an individual basis. They can avail of the incentives such as the 5 free sessions for gym and swim, and also take out a 35% reduction if they choose to do so. There is also a minimum of 12 months follow-up support as well. So I suppose at the start of the programme, I thought the job would be quite simple. I would receive a referral, make the phone call, arrange a meeting, then signpost to appropriate activities or services. It sometimes works like that, but the reality is that there are a lot of participants coming with complex needs. Other comorbidities, participants younger than 18. For example, I'm currently working with a 15-year-old girl learning to walk again after a brain tumour. I have participants where there's a language barrier and access to translators is difficult. People have to re-engage back into the service when there have been reoccurrences, and when one of our members pass away, it can have a devastating impact on everyone. But I feel the programme is a lifeline for everyone and excludes no one. Just ask any of my guys you see in the green in the leisure centre. So currently I have a group drop-in gym, 3 cancer-specific classes, 1-to-1 exercise sessions, walking programme, and I am also signpost to swimming lessons. These change seasonally, and we always try out new things. I am currently undertaking my water aerobics training and plan to offer this also. I suppose the one area I feel ABC has an added extra is in the development of evidence-based projects. Research shows that strength training can improve health in cancer patients. It will help with cancer-related fatigue and allow for muscles to build up strength again after muscle wastage due to chemo. Using money from my training budget within Macmillan, I was able to complete a national certificate in strength and conditioning. This allowed me to pilot a Couch to Kilos 10-week programme for participants, testing them on week 1 and then again on week 10 after being introduced into the gym environment. The pilot was a success. Every participant improved in all areas across the tests. I ran the programme again towards the end of last year and added a Couch to Kilos Plus programme for those that wanted to continue with their fitness journey. In terms of the difference we're making, I work with all cancer types across all stages. We've received 10,000 referrals right across Northern Ireland. We offer 30 plus activities. We work with a wide range of age ranges, and every week we provide over 60 cancer-specific classes in Northern Ireland. Looking at the graph, you can see the feedback coordinators receive from feedback forms given out at 6-month intervals. Improvements in lots of areas, including fitness, mobility, sleep, and importantly, 100% of participants said they would recommend the programme. But it is more than just exercise. Some people have told me that Move More gets them out of bed in the morning. People can come even for a chat before or after class. They can talk to people about things they don't want to worry family members about. It can be a chance to build trust within people outside their own inner circle, to ask for advice and to hear about others' experiences. A lot of what Move More offers happens in the background while the exercise takes place. Move More is about connection. It's unique. A programme ranging from 14 to 93 and beyond for those with a disability and for all ethnic groups and genders. It's being part of a family and meeting up with other groups across Northern Ireland. Most recently, as you can see in the pictures, a trip to Port Ballantrae for some Christmas festivities such as dance and chair yoga. And you can see we're enjoying a beach walk to finish off. Something many of my participants would never have thought possible. The programme also gives back, raising tens of thousands of pounds over the years. Biggest coffee mornings, World Cancer Day events, and recently supporting fellow employee Chris in a Dance Through the Decades fundraiser at South Lakes. He himself sees the great work that Move More does and wanted to raise money this year on behalf of Macmillan Cancer Support. Move More is, for me, feeling incredibly lucky to go to work each day with a smile on my face. It's painting and donating art because you care. It's baking until 3 a.m. for coffee mornings and trying new things even when you don't think you can. It is the social gatherings and supporting each other even when things aren't looking good. It's forming guard of honours at friends' funerals and being able to support one another to always look for the positives. Move More is not just another exercise programme. I have just a wee quote here from one of my participants when she talks about Move More and it being an absolute lifesaver. And I'm just going to play a video. Hopefully the sound will be okay. And it's just finished by looking at some of the Move More participants as we look forward to completing the mighty hike. And if anybody has any questions, if you can ask them after the video, that would be great.
Every Friday we take part in a walking group which is part of the Move More exercise group from Macmillan. We go to a different location every week.
All the people at the group have had some form of cancer, and it has been really a lifeline to everyone, and we keep active, which is what we were told to do after we had our diagnosis.
It has meant a lot in terms of support and friendship and motivation and keeping us all healthy. Well, we chose the Mighty Hikes because we all felt we wanted to give something back to Macmillan, and Nuala has made it very special, our coordinator. She has helped prepare us for this Mighty Hike, and hopefully we'll be all fit and well and able to do it. When you've been through cancer and treatment, you feel that maybe you're never going to do something like this ever again. So to be able to do it and to finish it will provide a great sense of achievement for everybody.
It's over 4 years ago now since I was diagnosed. My sister and my niece have both died through cancer. They didn't have the opportunities. I'll be thinking of them when I'm walking. And from my point of view, it's a question of giving back.
It has brought friendship, it has brought motivation, it has brought comfort, support, and we have learned so much about the benefits of walking and any form of exercise.
Since I joined the group, it's kind of coincided with me retiring from work, and I thought to myself, if I didn't have this, I would be maybe sitting every day at home. I wouldn't know what to do with myself. But it's given me an incentive to get up and get out and try to help other people as well. You know, it's been fantastic.
Just if anyone has any questions.
Nuala, thanks for that presentation, and probably on behalf of myself as chair of the Leisure Committee, I would like to thank you and your team for all the work you do. I know by your presentation tonight how much, on the sound of your voice, how much it means to you at the work that you do, and it's invaluable to those people that are diagnosed with cancer, and the entire Macmillan family who support patients and people who are in hour of need. And I would just like to personally thank you for all the work you do. Just before we move into questions, members, we have a confidential report in connection with this presentation, the confidential part of the meeting. So, but certainly open the floor to questions. Councillor O'Hanlon.
Yeah, thank you, Chair, and thank you, Nuala, for your presentation. As you said, Chair, you can tell by Nuala's voice her enthusiasm for the project. Can I just ask, in relation to the breakdown of participants in the programme, and you mightn't have the data tonight, but maybe if you could come back to us at a later point, in terms of the geographical spread of those who sign up to the programme, I think it would be useful if we could find out where people across the borough are picking up. It's just a notice. This is probably the first time I've heard of the programme, and I'd be keen to see if people are getting aware of it right across the area. So maybe in terms of we get a breakdown at some point in relation to those who are participating in the programme.
Yes, that's no problem. I do get a number of referrals, and they would be through healthcare professionals from the trust, but people can also self-refer onto the programme. So I would get a lot of referrals through people that are involved in Move More, and they think the service is good and they pass it on. It would be a widespread, right across the Armagh, Banbridge and Craigavon areas. And I would do a lot of the one-to-ones in, suppose, 3 of the main leisure centres, but also the smaller centres as well. I would tend to use a lot of the parks and open spaces across the council area, particularly Armagh, the likes of Gosford, Loughgall, and areas like that. But I try to make sure that I'm able to do house visits as well. So I make sure that if anybody sort of live in any rural areas, that access wouldn't be a barrier, and that I'm able to do home visits as well. Especially for those that are going through treatment and don't want to come into the centres. I offer that service as well. So, but I will get the sort of specific numbers to you. That's no problem.
Thank you. Councillor O'Hanlon, you want back in? Okay.
Yeah, Chair, that's great, and thank you very much. And also maybe if you could share contact details, how we could help refer people to you, I think that would be useful as well. So thank you.
Thank you, Nuala and Councillor Hannon. I don't see any other, oh. Sorry, Councillor Hannon, you looking in again? Sorry, okay. I don't see any other lights on in the chamber. There's no hands up. So, Nuala, I think that's all the questions you have. And thanks again for your comprehensive presentation and on the very important and dedicated work that you do. So, thank you this evening for taking the time.
All right, thanks very much.
Thank you. Okay, members. Moving on to our first decision item tonight, 3.1, is a contribution to the Mary Peters Trust, and Gillian is going to take us through that presentation.
Thank you, Chair. Good evening, member. Point 1, contribution to Mary Peters Trust. A request has been received from Mary Peters Trust for financial assistance. The Trust has recently supported 18 athletes from the Borough. It's recommended that approval be given to financially support the Mary Peters Trust for 23-24 with a contribution of £1,000. Thank you.
Thank you, Gillian. Councillor Hockian.
Thank you, Chair, and thank you, Gillian, for the report. Yeah, look, I'm more than happy to propose this. I suppose, without sounding like a broken record, for Gillian, I would ask for some clarification just on whether there's some method or way for the Mary Peters Trust to potentially help people from the GA community, because it seems like this is like a lot of the trusts and sporting organisations. The criteria is based on representing Ireland, GB or Ulster, which doesn't fit in any way really for the GA community, and I feel like they're potentially missing out. I'm thinking of handball in particular, where there's a lot of travelling. People do go abroad to play it, but it's based more on rankings, which is, you know, a good indication of the level that people are at in the local area. So I would hate to think that people are missing out. That being said, you can see from the report, like 18 local athletes is fantastic, and it's a small contribution for us to make as a council. So I'm more than happy to propose it. But I would ask if Gillian's able to, but probably not tonight. But if you could come back to me to see whether anybody from the GA background was able to access any kind of financial support from Mary Peters, and if not, maybe it's something we could ask them for clarity on if they've any plans to try and make that more accessible. Thank you, Chair.
Thank you, Councillor Hockian. Gillian, do you want back in? Okay.
Yep. So thank you, Chair. Thank you, member, for the question. I have reviewed the criteria, and I would agree that it seems a wee bit unclear as to whether GAA are able to apply to Mary Peters Trust or not. And noted on the list that they sent us through of the athletes that they had supported from our borough, that there wasn't any GAA athletes included in that. So I'm happy to go back to Mary Peters Trust and try and clarify that for you and come back. Thank you.
Thank you, Gillian. Okay, members, we'll have a proposal to accept the recommendation by Councillor Hockian. Have a seconder for that. Councillor Herr has seconds that. All agreed, members? Great, thank you. Okay. Our next decision item is item 3.2. It's the pedestrian gate at Lochgall Country Park, and Martin will take us through that. Thank you.
Thank you, Chair, and good evening, members. Chair, we have an entrance to Lochgall Country Park at Lochgall Village itself, right in the middle of the village. During the pandemic, there was a massive rise in the user numbers for the park, and that led to traffic congestion in around the gate itself, with a lot of illegal parking and restrictions on traffic on the actual road. On the advice of PSNI, we introduced a schedule for opening and closing the gate to try and discourage people from coming along during the evening times and causing the obstruction. Obviously, Chair, things have normalised since the pandemic, and we are able then to better access the car park in the park itself. And so, Chair, we are proposing then that we would revert to opening the gate and leaving it open for a 2-month period. On the basis that if there are any other issues around parking at the gate, then we would revert to the open and closing schedule. But if not, then at the end of the trial period, if all being well, then we would leave the gate open then going forward.
Thank you, Martin, for that. Have any questions in regards to that? Yeah. Councillor Hanlon.
No, Chair, I'm just happy to propose.
Okay, members, we've heard that we propose to accept the recommendation by Councillor O'Hanlon. Have any seconds for that? Okay, Councillor Ratliff, thank you. You seconds that proposal. All happy, members? Okay, thank you. Moving on, our next item is 3.3, the primary club funding for C Sports Challenge programme, and that will be took through by Gillian as well. Thank you.
Thank you, Chair. Yes, item 3.3, the primary club funding for C Sports Challenge programme. Officers on the RNIB would like to extend their inclusive outdoor activity sessions, and they've submitted a funding application to the primary club. It is recommended the members agree that the strategic director accepts any letter of offer received from the primary club for £23,370 to deliver this programme. Thank you.
Thank you, Gillian. Yes, a very worthwhile programme, and another good news story that we're delivering for people. Lord Mayor.
Thank you, Chair, and just happy to propose the recommendation. But I just had a question. The participants to the programme, are they from the ABC area, Gillian?
Thank you, Chair. Thank you, Member, for the question. Yes, the majority of the participants would come from the ABC area, but I do believe that it's open to people from outside the area as well.
Thank you, Gillian. We have a proposed by our Lord Mayor that we accept the recommendation. Have a second, sir, for that? Councillor Hare, thank you. Second. All happy, members? All content? Thank you. Our next item is an information item, 3.4. If anybody has any questions in regards to sports development report. Okay, Lord Mayor.
Yes, thank you, Chair, again. And first of all, whilst it's for noting, it's worthy of being discussed and said how how fantastic what we're doing here, in all of that report. Just one automatically jumps out at me, and anyone that knows me will understand why. It's to do with our young people and employability, and that programme that we're running from January through to March, that they had 31 registered. I'm just curious to know, we're almost halfway through that course now, and I'm just wondering how many participants of our young people actually, I know 31 register, but how many actually showed up and how many are still halfway through on the course? And the other thing was, Chair, through you, if I could ask Gillian, did we run this before? And if so, did we actually employ anyone from it? Thanks.
Thank you. Thank you, Lord Mayor. I'll bring Gillian in.
Thank you, Chair, and thank you, Member, for the question. So the programme's still running at the minute, and actually this week there's 25 young people doing their MPLQ up in Orchard Leisure Centre. So hopefully they will all complete that, and I'll be able to give you a further update at the end of the programme. So yes, we have run this before. So this is our annual Sport in the Community programme, the employability aspect of it, and we've actually done a wee bit of research recently, trying to track where participants have went to over that programme. But I just don't have that information with me tonight, but happy to provide that with you tomorrow if that's okay.
Thank you, Gillian. At this point in the meeting, we have no correspondence. So I'm seeking a proposer and seconds that we we go into committee for consideration of confidential items of business proposed by Alderman Burns and seconded by Councillor Hare. Thank you. Members and the online viewers, in accordance with the Schedule 6 of the Local Government Act, we will now be moving into confidential session of the council. This means that we will be turning off the public feed of the meeting. This will be returned when the meeting is restarted. Can I ask ICT officers to please turn off the feed and confirm with me when the confidential section of this meeting can proceed? Thank you. Can I seek a proposer and seconder to agree that the recommendations made in committee? Proposer and seconder for that? Councillor Hockey proposed and seconds by Councillor Hare. Thank you, members. Okay, members, we have no any other business tonight, so that concludes our February Leisure Committee meeting. Thanks for all attending and safe home. Thank you.